I'm joined by Dr. Sascha Edelstein, who is a fertility specialist in Cape Town. We're going to be talking about fertility and infertility. So Sascha, thank you so much for joining me on the couch.
It's a great pleasure.
Well, you've just come back from a conference in Prague. So we want to know what is new in the world of infertility.
I guess we're trying to have more detailed assessment of our patients, trying to understand where the problems lie. We're trying to take more care in our treatment protocols so that there are less side effects for the patient through the treatment processes. And then when we're doing treatments like IVF, we're wanting to have a better way of evaluating the embryos in order to choose which are the best embryos to put back. There's also an interest in looking at cryopreservation, freezing embryos and freezing eggs, freezing oocytes. I think one of the other messages that came out, if I may say, was looking at people that are going through cancer treatment, so men and women that are going through cancer treatment, and thinking about fertility preservation for them. Their life span is improved with treatment, but the chemoradiotherapy would impact on their fertility. So that would be a group of people that could have fertility preserving treatment.
Okay, can you tell me what exactly is IVF?
IVF, in vitro fertilization, would be one of the assisted reproduction treatments that we offer couples who are struggling to conceive. Essentially, it is bypassing the fallopian tubes.
Okay.
We would stimulate a woman to produce multiple eggs and then retrieve them from her body under anesthetic and then combine with her partner's sperm in the laboratory, allow the egg to be fertilized and grow on, and then put them back into a uterus at the ideal time.
Wow. I know there's something called mini IVF. Is this the same thing?
Well, the various different stimulation protocols that you can use for IVF. And so in the past, what we were trying to do is maximize the egg yield. So using lots of medication to try and promote multiple egg follicle development. And there's now been a shift away from this. There's significant side effects for the woman. And a mini IVF would be using her natural cycle, so with less medication, aiming to retrieve fewer eggs, but still to be able to get embryos to put back. So it's a softer simulation, which we are definitely doing in certain cases in South Africa.
So it is available in South Africa?
Sure. It's just adapting the treatment protocol, so using less medication, and the indications, the reasons to do that would be if the woman has an adverse reaction, she can't tolerate standard stimulation, somebody that maybe has significant migraines with estrogen, if the stimulation is contraindicated, if she's a poor responder, so she doesn't respond to medication, there's no point in putting on high doses, and an older woman.